So today I'm going to talk about neurodiversity. Who has heard of the word neurodiversity? So I can go home now? Okay. So a lot of you have heard about neurodiversity, and I'll tell you more about this. So first I'll give you an introduction on what we mean by neurodiversity, and then we'll tell you more about how we conceptualize neurodiversity in a way that can be made actionable. And that's the strength-based model of neurodiversity. And then basically with that model, we have built several programs out of it within the Stanford Neurodiversity Project, and I'll tell you something about that. And then we can ask all of us how we can work together to maximize the potential of neurodiversity. So neurodiversity is really, just like the word says, is about the diversity of the brain. So when we have been talking about different kinds of neurodiversity in a lot of initiatives out there in the society, a lot of the time is focused on differences in race, in ethnicity, in gender differences. But how about the brain? We haven't been really focusing on, as a society, in a large scale to embrace the differences of the brain. And neurodiversity is really just about that in terms of regarding people with differences in their brain function and behavioral traits as part of normal variation of the human population. When we talk about neurodiverse conditions, some of you may think about autism. Maybe some of you will think about ADHD or maybe even dyslexia, but it doesn't really end there. The brain is different for different reasons, and sometimes there are some challenges that people may have when they have these neurodiverse conditions. But a lot of the time, because of their differences in their brain, how it works, people's tendencies in their behavior can actually be an asset. So I'm just going to tell you more about that. And in terms of like the statistics, right now, autism has a prevalence of 2.3%. Dyslexia is much higher, 13 to 14%. And ADHD is somewhere in between, 5 to 7%. So when you're grouping all of these together, not counting the rest of the conditions that I have listed, neurodiverse conditions would be clearly the largest minority group in the world. So we are not really paying attention to that until more recently. And when we think about neurodiversity, we also think about human abilities. And when you think about human abilities, you may think about where people are landing to in maybe a bell-shaped curve. So if you remember your really basic statistics, the middle 68% of the people are average. On the right side would be above average, on the left side would be below average. And a lot of the time when people talk about human abilities, it's quite common that they would think about IQ. And right off the bat, I just want to tell you that it is very limiting because it's only telling us part of human abilities. So someone with an IQ of 85 to 115 will be in the average IQ. On the right side, some people with 130 IQ will be pretty smart. 145 will be at the genius level. On the other hand, on the left side, people with IQ of under 70 will be considered to have intellectual disability. And this is limiting because it's only telling us about visual spatial, verbal linguistic, logical mathematical abilities. IQ doesn't really tell us about anything else in terms of like musical abilities, athletic abilities, how you work well with the nature, how you work with people, how you understand yourself, and how you appreciate your own existence and the universe's existence. So Howard Gardner at Harvard University have this theory of multiple intelligences to give us a more complete picture of human abilities. So when we think about like human abilities and who is one of the smartest people on Earth, maybe it's some of you are some of the smartest people on Earth, but I'll just pick Albert Einstein for now. So Albert Einstein has this profile. We call it multiple intelligence profile. Musical rhythmic, he would be almost above average. He played the violin. Visual spatial, way up there in the genius level. Verbal linguistic, actually not so high. He didn't speak until 4 years old. Logical mathematical, probably he's just standing on his own island. So naturalistic average, we look at interpersonal and intrapersonal, he actually struggled quite a bit. And body kinesthetic average, he at least ride a bicycle on time. So when we are thinking about Albert Einstein as someone that changed the world for the good is really what he's good at that we remember. We won't be talking about his personal struggles over and over again because it doesn't really matter. It's only mattering for him, maybe the other people that are close to him. But for the bigger picture, his strengths is really what matters. And a lot of people are like Albert Einstein, that is very much able to be drawn to something that he is very interested in, and because of that, he would spend a lot of time really digging into the very depth of the field. So people here include Isaac Newton, this Alan Turing, who arguably built the first computer, and because of that, cracked Enigma, which is the encryption machine that the Germans used in World War II. So arguably he stopped World War II. And this is Nikola Tesla, and this is the guy that owns Tesla now, Elon Musk. And we have Julia Bowman-Robertson, a mathematician, Sophie Germain, also a mathematician, Per Erdos, a mathematician, and this is one of the first African-American scientists, Benjamin Banneker, and philosopher Immanuel Kant. This is Charles Darwin, who's father of evolution. This is Barbara McClintock, who won the Nobel Prize in Medicine in 1983 for the genetics work that she has done. And this is Diane Fossey, who teaches us everything about gorillas. This is Temple Grandin. She is the most famous autistic individual talking about what autism is, and she is also an expert in animal science. And this is Greta Thunberg, who is, I would say, the most effective environmental activist. She's on the autism spectrum, and because of her passion in the environment, we all benefit. And there are also others here, Michelangelo. So these are all artists. There's Andy Warhol, who is the father of pop art. And then Wassily Kandinsky, Joseph Corel, Stephen Wilshire here. Stephen Wilshire is an interesting person. Anybody heard of his name? So he can literally just ride a helicopter, go up the sky for about 20 minutes, memorize the entire city, and then would come back down to start drawing, and he can draw the entire city in great detail. in front of tens of thousands of people. And it's not like one place. He has done this in many, many cities around the world. So he also had the diagnosis of autism when he was 3. And then we have musicians like Mozart here, Glenn Gould. These are the writers. This is Lewis Carroll, who wrote Alice in Wonderland. And then Hans Christian Andersen. This is Freddie Jelinek, who is one of the Nobel Prize winners in literature, as well as one of the first patients that Hans Asperger described in 1944. And then we have Andy Kaufman, Dan Aykroyd, Susan Boyle, Daryl Hannah. These are all people in the entertainment industry. Jim Henson, and who is that? Satoshi Tajiri, who is the creator of Pokemon, and then Mike Burry, who is an American investor and pathologist trained here at Stanford. He's actually also in the movie Big Short, if someone knows that movie. So all of these individuals, they either have the diagnosis of autism or they have traits of autism, and we believe that they are most likely on the autism spectrum. But some of them, they were born way too early. We can't really give them a diagnosis, but we are quite confident that they are, for what the history books are saying, these very influential people, they are likely to be on the autism spectrum. So you can see that people on the autism spectrum here can be representing different walks of life with different professions. And one thing that is in common again is they are very much endeavoring their life to something that they are passionate about, and then that really changed the world for the good. And there are also others that don't have autism, but they have ADHD. There's Alexander Bell, who invented the telephone. Thomas Edison invented the light bulb and many, many other things. JFK, and there's Sir Richard Branson, who founded Virgin Group. And then we have some athletes here. Michael Phelps, who won more Olympic gold medals than anyone. And Simone Biles, a gymnast, Olympic gold medalist in gymnastics. And a bunch of people in the entertainment industry or journalism, like Lisa Ling, Emma Watson, Liv Tyler, Howie Mandel, and Justin Timberlake. And a lot of them are talking one thing that is in common. They all say that without their ADHD, they are not going to be as successful as they are. So now we have another group of individuals that have dyslexia. We know Jay Leno, Whoopi Goldberg, and this is Sir Jackie Stewart, who won more Formula One races than anybody. And then we have Nobel Prize winner Carol Greider, who discovered the enzyme telomerase. And we also have a couple of doctors. One is Stuart Udofsky, chairman of the Menninger Clinic in Baylor College of Medicine. And then Toby Cosgrove is the president and CEO of Cleveland Clinic. So especially for these three individuals, if you are thinking about what they had as a diagnosis of dyslexia and what they do as a profession, they don't really align so well, right? So some people may think like if you need to become a doctor or a scientist, you have to read a lot. So if you have dyslexia, then it will be a really big challenge. So these people really make their challenge their strength. So basically, the diagnostic label does not really label them as someone that cannot do certain things. So neurodiversity can become a competitive advantage. So now I'm going to talk about the strength-based model of neurodiversity. And it is very different from the disability model, which focuses on the diagnosis. Strength-based model is really about what the person can do. You can see all of these different traits. And say, for example, in defining autism, there is a set of characteristics. And some people may think that if someone is doing things over and over again, and it's not going anywhere, then it will be labeled as perseveration. However, if the result is good, you're not going to call it perseveration, you're going to call it persistence or perseverance. So it is really contextual. Seeing big picture may not be the typical tendency for autistic individual. They tend to be drawn to details. If you are wanting someone to solve problems that require details, then you probably don't want that person to keep looking at the big picture, right? So basically, if you have someone that is on the spectrum that wants to be drawn to details, that person should not be penalized by not seeing big picture once in a while. They tend to have fewer interests, and when they have the interest, they would really spend a lot of time to dig into the fund of knowledge like no other. A lot of the time, people on the spectrum do not take someone else's perspective right away, but they are also very concrete and honest, very straightforward to work with. Social interactions may not be their strong suit, but they can be the most loyal friend anyone can have. So one set of characteristics of autism that can be spun to either strengths or challenges or both at the same time. And what is going to matter is the environment. When the environment is allowing the individual to show their strengths and be acknowledged as such, then people will just see their strengths more and they will be doing quite well. We're not saying that there are no challenges, because there are challenges, but if they are understood, then people would be able to steer the individuals to the right direction. People with ADHD is also similar in that it's one list of characteristics that can be both challenges and strengths. So impulsivity will come with rapid decision making, hyperactivity will come with high energy, difficulty focusing on tasks that they are not interested in will come with hyper-focus on tasks that they are interested in. Distractibility will come with creativity, and in fact, creativity of ADHD is one of the most documented traits of ADHD. And the strengths can also come with resilience, multitasking, big picture thinking, and cool in a crisis. So this list looks like the traits of a CEO to me. So like Richard Branson, for example, he is a CEO, and there are many people that are in the CEO position that are very able to do a lot of things very well, as long as they are passionate about it. Dyslexia is a little bit different in terms of the construct. It's not one set of characteristics that can be both challenges and strengths at the same time. They are discretely different. The challenges that they have are about reading, writing, spelling, time awareness, rote memory. The strengths are, they are very good problem solvers. They are highly creative. They are very observant. And they are very good social interactions. And if you are to try to memorize the strengths in an acronym, it will be MIND strengths. So material, interconnected, narrative, and dynamic reasoning. The strength-based model has 4 major components, and I'll describe a little bit more in the next few slides. The first is positive psychology. Second is positive psychiatry. The third, we already talked about the Gardner's theory of multiple intelligences. And then the fourth is the Chickering 7 vectors of development. And we consider neurodiverse conditions as conditions rather than disorder, and acknowledge challenges rather than deficits. And that's really important, because if we call these conditions disorder and the challenges deficits, it's going to be really hard to make the challenges strengths. But if we say in a more neutral way conditions, then the condition can be spun to strengths, and sometimes it can be challenges. And we want to apply the strength-based model across the entire spectrum of neurodiverse conditions. And this is the front cover of my book. Positive psychology was founded about 20 years ago by Martin Seligman and Mihai Csikszentmihalyi, and they regard the core of positive psychology as well-being, contentment, satisfaction. Flow is basically immersing oneself in an activity and get satisfaction out of it, and happiness and hope and optimism. The last 20 years, there are many definitions and themes of positive psychology, but these 3 come up top. And if you want to even boil down to 3 words, not 3 sentences, it's really about strengths, about fulfillment, and about growth or development. Positive psychiatry can be contrasted with traditional psychiatry in that positive psychiatry is focusing on what's positive and what's protective, what can make things better. Traditional psychiatry is more of a medical model that is focusing on what's wrong and what are the risk factors. The treatment goals for traditional psychiatry are usually symptom relief by medications and short-term psychotherapy. Positive psychiatry is about increasing well-being and growth through psychoeducational interventions. And this approach can get the individual to be in a good place for a long time in their lifespan. And because of that, there will be less chance for them to need to have more serious symptoms, because they are already in a good place most of the time. And the last component of the strength-based model of neurodiversity is the 7 vectors of development. And these 7 vectors are basically the developmental tasks that all adolescents and adults or young adults would need to achieve in order to become a full adult. So they can include developing competence, managing emotions, moving through autonomy toward interdependence, developing mature interpersonal relationships, establishing identity, developing purpose, and developing integrity. And we asked 3 questions. How can we help neurodiverse individuals achieve these developmental milestones? And also, how about the other people, the other people in the ecosystem? How can they help the neurodiverse individuals by making the environment more neurodiversity friendly? And also, the last is, how about the mental health providers? How can we contribute to developing neurodiverse individuals instead of fixing problems? So if we are to apply this model to neurodiverse individuals, it will be to raise their awareness through personal strengths, increase their trust in their personal abilities, help them learn to engage in relationships and increase self-satisfaction through success. This way, they will be moved away from negativity and immobility such as anxiety, depression, and executive dysfunction. The Stanford Neurodiversity Project is basically using the strength-based model of neurodiversity to help change the environment to make it more neurodiversity friendly. And it is a special initiative of the psychiatry department, thanks to Dr. Laura Roberts, our department chair, to ask me to do this project. And it's been about 5 years now. It is very much in line with the ideal initiative that we have in the university. And the objectives of this Stanford Neurodiversity Project are manifold. The first is the most important, is about changing, establishing the culture that treasures the strengths of neurodiverse individual. And this way, if we do it right, we can empower the neurodiverse individual to build their identity based on their strengths. And this can last for a lifetime. We want to attract the most talented neurodiverse individuals to study at Stanford and work at Stanford, and also partnering organizations. And we want to train talented individuals to work with the neurodiverse population and disseminate this model as widely as possible. And ultimately, we want to maximize the potential of neurodiversity, not only for neurodiverse individuals, but for all of us, because they have so much to bring to the table. So as much as we are very person-centered, we are really using an ecosystem-driven approach. Every neurodiverse individual has family, friends, mentors, therapists. And in the education setting, there are teachers, coaches, classmates, roommates, and the school officials, school community in the larger circle. They can all contribute to making the education environment more neurodiversity friendly. And similarly, the employment setting, we can see that other individuals like the supervisors, colleagues, executives, work community can also make the workplace more neurodiversity friendly. So we target each of these stakeholders in this ecosystem and tell them about neurodiversity in this neurodiversity awareness and education initiative. We also actively teach people as employers that can make neurodiversity as an initiative. We also have a neurodiversity independent living skills initiative. And embedded in these initiatives are multiple programs that we have been building over the last few years. So all of these programs are within the scope of 5 things: clinical innovation and service, educational excellence, advancing science, leadership, and community commitment and engagement. About 5 years ago, that's when we started a special interest group for neurodiversity. So it's been like really good that every month in the last 5 years, we were able to ask someone knowledgeable in some aspect of neurodiversity to come talk to us. So far, we have over 1,000 people in the special interest group. And if you want to join the special interest group and learn more about it and join our Monday, we have every 3rd Monday of the month, we would meet virtually, and someone will talk about a topic on neurodiversity. So here are some of the places that I have been invited to talk about neurodiversity, including United Nations. And there are a lot of benefits that we know neurodiversity can bring to organizations. And that's why this is going to be more and more adopted. And just in a couple of days, we are going to have our 3rd Stanford Neurodiversity Summit, and we have about 2,000 people registered already. It's also a virtual meeting. We have a very good lineup from doctors on the autism spectrum to film producers on the autism spectrum, actors with ADHD, and many other neurodiverse individuals talking about their successful journeys. And a lot of the time, it's not only success, they also talk about their tortuous path, because a lot of neurodiverse individuals tend to have a atypical path in their development. And if you want to visit our website for the summit, please take a picture of the QR code or reach our summit website. You can just Google Stanford Neurodiversity Summit and it will show up. Other things that we do in the Stanford Neurodiversity Project include we want the Stanford Neurodiversity Project to be a project that can be able to help neurodiverse individuals at all different levels. But in order to do that, it's very difficult. It's difficult to work on every single level. So we strategically work on neurodiversity at work first with employers, and then after just a few months, the high school students knock at our door and say, you have to do something for us. And then we figure out, we basically created a summer camp. So we have run it for 4 years now. It is called SNP REACH, Stanford Neurodiversity Project Research, Education, and Advocacy Camp for high schoolers. And basically it is a camp that's virtual in the last 3 years. And we are teaching students, high school students, about neurodiversity and design thinking. And basically, design thinking is an approach that would ask the individual to deeply empathize what is needed from a particular user group, and then try to define the problem, and then try to articulate exactly what can be done, and then build a prototype, and then even test the prototype in an iterative fashion in this cycle. So with this kind of approach on campus, there are many really wonderful things that have happened, from like inventions to starting companies and so forth. And very similarly, the high school students, they are also doing something very remarkable. During their 2 weeks camp with us, every day from Monday through Friday, they spend 6 hours with us. So basically spending a total of 60 hours with us. And within that 60 hours, they are able to even this is the composition of the group. The students, like last summer, just a couple months ago, we have 90 students in 2 groups, about 45 per group. And about 1/3 of them have identified themselves as neurodiverse. And the other half, they are not neurodiverse themselves, but they are very interested in neurodiversity. And they come from all over the world. I mean, mainly in the US, but there are a few that they literally follow our Pacific time from this is India, and this is Malaysia. No, this is India, Malaysia, and this is Hong Kong. And these students join the rest of the students for 2 weeks. They are basically night out for 2 weeks. And they did really remarkable project with us. And one group, many groups are doing really amazing things. And one group, they basically wrote a book about neurodiversity, and even illustrated a book and published in Amazon for free, all in 2 weeks. And this is only one of the examples. There are 12 groups in this summer, and this is another group about cooking up neurodiversity, getting a recipe book and a website that's good for neurodiverse individuals, because neurodiverse individuals tend to be more picky for their own reasons, maybe sensory differences or something like that. So this kind of course, it may be very simple in terms of teaching the concepts of neurodiversity, but the consequence is enormous. The students are really spreading the word. Some of them are even invited to other schools to talk about their experience. So I don't have to go anymore, the other people talking about it. So I can spend time talking with you, for example. Okay, so there is also Neurodiversity at Work program, and we basically have a program that teaches the employers and the neurodiverse individuals on how to work better together. We have various departments, including this particular institution, Hoover Institution. This building belongs to Hoover Institution, and they have a few neurodiverse individuals working in Hoover, and same for the Neuroscience Institute, the Department of Comparative Medicine, Humanities and Sciences, and many other departments that are working with us, but they haven't actually hired someone on the spectrum yet. And many other organizations outside of Stanford, like Google, I've already trained several hundred managers there to make the workplace more neurodiversity friendly. And even smaller organizations, even Animal Sanctuary, we work with the largest organizations to the smallest organizations, just to make sure that we are all able to get the word out to different sectors. Neurodiverse individuals have multiple talents, and sometimes maybe tech industry, sometimes it may be related to something that is very specialized, and it may not be even science. So we want to make sure that everyone have a chance. So in our Neurodiversity at Work program, we have a candidate registry as well as a job bank. And basically what we try to help the neurodiverse individual and the employer is to find each other. And along the way, we would help with changing their practices. Because 80% of people on the autism spectrum are unemployed or underemployed. And it's not because they are not smart, it's because they are not very good at maneuvering the social interactions in the typical human resource process. So basically, we would negotiate with the with the employer, and train them. And in parallel, we also train the neurodiverse individual in both the recruitment phase as well as in the transition phase after there is a match, after the onboarding. So every neurodiverse individuals would have 2 support circles. One is the workplace support circle, the other is the personal life support circle. So we have a coach that support the employer team, and also another coach that support the neurodiverse individual. And sometimes family members also come into the picture. So these 2 slides are basically telling us that we have our curriculum that we have built over the last few years. So in summary, neurodiverse individuals offer a lot to the society. And they do have specific challenges, but they can be overcome. And we talk about how to conceptualize neurodiversity using the strength-based model of neurodiversity, and use the concepts to implement projects that can be made practical and actually help some people in the real world. So how can we work together? Consider joining our special interest group, or if you're interested in neurodiversity, let us know what you're interested in. And if you know any neurodiverse individuals that want to find a job that's in neurodiversity friendly place, then tell us. Or your organizations, you can tell us if your organization is interested in learning more about neurodiversity. So by working together, we can make a difference to the neurodiverse community and beyond. So these are the wonderful people that I have the pleasure of working with in the last few years. And thank you so much for your attention.